Hello, everyone. I'm Daniel Fish from Historic Beverly, and welcome to our Spotlight Talk on Dr. Joshua Fisher's medicine chest. During this presentation, we'll be going over the medical practices of the colonial era, as well as the background on Dr. Fisher and medicine chests used on privateer ships. I will also be transitioning between slides, and I will try to let you know when this will happen, as there may be a delay during transition. Now we'll begin with an image on our first slide. For some background, let's go over who Dr. Fisher was. Joshua Fisher was born in Denham, Mass. In May of 1748. He was admitted to Harvard College at the age of 14, which required a fluent essay in Latin in order to be considered for acceptance. The average age for getting to Harvard was 15 years old. Fisher graduated in 1766 at the age of 32. He became a school teacher in Rowley until he fell ill with tuberculosis in 1768. It was after this experience with tuberculosis that Fisher decided to dive into the field of medicine. He apprenticed under a Dr. Bella Lincoln of Hingham, Mass., and after several years, he passed his exams and gained a license to practice before moving to Beverly in 1774. Licensing physicians would not become commonplace until 1791 and into the 1800s, where those in the medical field needed to be approved by medical boards due to increased regulation. Since there were no organizations or affiliations to enforce any particular form of medicine at the time, colonial physicians were free to choose therapies from herbalism to what they called Indian medicine, as well as from their formal or informal medical education. Dr. Fisher eventually died on March 15, 1833, at 84 years old due to lung fever, also known as pneumonia, likely due to his tuberculosis back in his 30s. Now we'll be going to our next slide. This is an image of 86 Cabot Street. Dr. Fisher was considered a pillar of his society, and his status was that of a local minister. After his passing, a few months later, the Fisher School was founded and is thought to have been named after him. The Fisher School emerged on Washington Street and would only be around for a few years until it merged with the Washington Street Academy, also known as Beverly Academy. In addition to this, Joshua Fisher was responsible for building 86 Cabot Street on the corner of Cabot and May, which is still around today, though it looks a little bit different than what you see here. Now we'll be going to our next slide. During his time as a doctor, Dr. Fisher also performed inoculations against smallpox. This was done by introducing smallpox pustules into the skin, whether through a cut in the hand or further up the arm. It was carried out on people typically in good health to aid in bolstering their resistance to the disease. It would cause a less severe fever and pustules before the person recovered. This practice evolved into vaccination in the late 18th century as smallpox vaccination became more widely known. It was carried out through giving someone cowpox, a less lethal disease to humans, which led to quicker recovery times and immunity from the much deadlier smallpox. This item is a receipt of payment from Elizabeth Lovett to Joshua Fisher on November 20th, 1792. It is for inoculating 5 children with smallpox and attending to them during their recovery. The receipt reads, "Received of Elizabeth Lovett, admin on the estate of John Lovett III, for the sum of £3 for inoculating and attending with the smallpox of 5 children: Elizabeth Lovett, Josiah Lovett, William Lovett, Joanna Lovett, and Augustus Lovett. Now we'll be going to our next slide. Here you can see our medicine chest, and for this instance, we will be unsharing our screen so you can see the chest in full. Hold on one moment. Here we go. This object is a wooden medicine chest, and on top of each of the 3 sections you see, above the drawers are grids of wood panels capable of holding bottles of various sizes. These were used to store both bottles as well as various medical supplies such as bandages. Once stocked, both sides could be rotated inward toward the center, allowing the lid to cover all 3 sections. It is believed to belong to Dr. Fisher, who served on numerous privateer missions. There were not many physicians on privateer vessels, as it was difficult to come by to have a physician on every ship. If a ship possessed a medicine chest but no doctor, which was often the case, the captain designated someone to tend to patients. That person needed to be able to read and write. However, if he lacked the knowledge of Latin, deciding which medication to give became a problem, as all of the bottles of medicine were labeled in Latin. Often, the captain or higher-ranking personnel capable of reading listened to the plates of sick soldiers and thumbed through a medical text until symptoms matched their description. In the 1770s, Dr. Fisher is listed as a surgeon on the privateer vessel out of Marblehead. During this time, the ship was captured and taken to England, where Fisher ultimately escaped to France. It is unclear if this medicine chest is from when he was initially captured or afterwards, when he likely joined another privateer ship. Now we'll be going back to our slideshow. And be moving to our next slide, where we'll be talking about medicine and the bottles within them. In John Woodall's The Surgeon's Mate, first published in 1617, it aided many in treating what ailed a ship's crew. The manual listed the instruments and medicines found in the medicine chest and explained how to use them. Special instructions explained what to do for medical emergencies. Various ailments were also discussed, such as scurvy. Woodall provided his readers with 281 remedies. Among the tools and supplies found in medicine chests include knives, razors, syringes, grippers for extracting teeth, scissors, splints, sponges, weights and scales, a tinderbox, a lantern, and many other important supplies, making the medicine chest a thing that was very valued. In fact, when Blackbeard blockaded the port of Charleston, South Carolina, he demanded such a chest in exchange for his hostages, who were leading citizens of the town. This would place the estimated value of a medicine chest at roughly 300 to 400 pounds. Whether the chest was large or small, the medical practices of the time called for substances encompassing a wide range of products. 18th century medicine combined traditional herbal drugs, oils, spirits, including various alcohol-based compounds, poisons, salts, sugar or honey, and other items in order to aid the medicine in the taste of it. Some compounds seemed quite sinister by today's standards. Calomel, once widely prescribed as a purgative for the treatment of syphilis, was in fact a form of mercurous chloride. Sugar of lead, also known as lead acetate, was used to treat eye problems and gonorrhea. Elixir of vitriol a mixture of sulfuric acid and brandy, flavored with cinnamon and ginger, was used as a tonic for stomach ailments. And then there was opium, commonly included in pain medicines such as laudanum, and addictive then as it is now. These bottles that you see here came from Dr. Fisher's medical chest and were tested by environmental professionals from UMass in 2003. They concluded that 3 of the initial 11 bottles in the chest contained hazardous chemicals such as mercury and lead. Guidelines were eventually established within colonial navies that every vessel over a certain weight or with a certain amount of passengers were required to have a medicine chest put up by an apothecary of known reputation. These were always accompanied by directions for administering the same medication to multiple people. The chest must be examined at least once a year and supplied with fresh medicine to ensure effectiveness. Another book, The Seaman's Friend, published in 1841, explains the laws concerning the responsibilities of the ship owner and sick seamen concerning payment for medical treatment. He sums it up as follows, quote, "The seaman is to be cured at the expense of the ship, of a sickness or injury sustained in the ship's service. But if he contracts a disease by his own fault or vices, the ship is not chargeable. A seaman is entitled to proper nursing, lodging, and diet. If these cannot be had or not furnished on board the vessel, he is entitled to be taken on shore to a hospital or to some place where these can be obtained. He is entitled to be put on shore if his disease requires it. It is seldom that the proper care can be taken care of on board of a ship," end quote. For the most part, going to sea was a young man's calling. Seamen, most in their prime years, were about as healthy as they could ever expect to be. However, seafaring subjected them to risks above and beyond what they would have experienced had they remained at home. Ships crawled with insects and rats, filth accumulated in the bilges, food stores were frequently rotted or infested with vermin, and fresh water often went afoul. The diet was monotonous and lacked the vitamins necessary for maintaining good health over long journeys. The work required physical dexterity and the agility that would be exceptionally hazardous. Extended voyages to distant, often hostile climates provided even greater opportunities for mishaps and disease. Now, I wanted to thank you for coming to our Historic Beverly Spotlight Tour on Dr. Joshua Fisher's medical chest. If you have any questions, please feel free to email us at research@historicbeverly.net. Be sure to find us on Facebook and check out our website at historicbeverly.net for any of our upcoming events. All images used in this presentation can be found in our collection on our website at beverlyhistory.pastperfectonline.com. Thank you and have a good day.